They did for me on my submal, which is the anti-malaria, which we're about to do the clinical trial now, was done at NIPRIT. This work was reviewed when it was sent for publication in an international journal, and that review was done by WHO, and they accepted it, and they sponsored me to present this at the United Nations in Ethiopia, which you were also there. So we have I have very good relationship. All the 12 recipes for cancer, subfat 5, 6, 7, 8, 9, 10, 11, 12, which I have discovered for the treatment of cancer from various foods, were and are still being analyzed and evaluated by the same institute. And the results I have for subfat 5, 6, 7 for onward presentation to NAFDAC have all been evaluated there. And the results in terms of efficacy are quite encouraging. WHO's policy, why they are encouraging this herbal drug, is because of drug accessibility and affordability. These are the two most important considerations WHO has. In my earlier interview at the NTA on the Panorama, I did say that we are working on a herbal drug that will be used in treating malaria. About a year ago, in one of the panoramas, I did say this, and I thank God today that that has come out and it has been given an international acknowledgement. That is Submal for the treatment of malaria. And as I speak with you, I have also developed this further to get a malaria vaccine out of Submal. My capsule is packaged by 60. That is Submal vaccine sort of. And if you are in a malaria-infested area, you use it BD, one morning, one evening, for 1 week, and it confers immunity for you for 3 months. At the end of the 3 months, you use it again, BD, it gives you another 3 months. That means you use it 3 times in a year, 3 or 4 times in a year. You divide 4 times in a year. And I intend to, it's packed by 60, and I intend to sell it for maybe 1,000 naira. 1,000 naira, and it covers the whole of the year. And in terms of cost, I think it's quite cost effective. If you're on this material, mosquito bites you, the mosquito will not be able to have effect to give you malaria. So the lost man hour of you're going to hospital, getting injections and all that will not arise. Our herbs, which is very effective in controlling BP. A lot of my patients are listening to this interview, and they have bought them. They are quite effective. You don't need to use it along with moduretic, which makes you to urinate, a diuretic, because my own product, the herbs, is the diuretic in itself. It makes you to pee a lot. It brings down the BP. It reduces your cholesterol level. And at the same time, it reduces your palpitation. You know, some people, when their heart beats, as if it's dropping. So it calms all that. And it can be used alone instead of Aldomet, or some people use nifedipine, Novask, 3 combinations and all that. This one is 1 in 1, and it's quite effective. You only use SAB alone just because once you have high BP or you have diabetics, usually you have low libido as a result of the synthetic drugs that you are using. Your libido is flattened, 0. You may have heart issues. You may have eye issues. Whereas my herbs reverses all that within a week of use. My DAPS for diabetics reverses the 3 symptoms. And if you use the 3 together for prostate cancer or cancer of any system, it also reverses these 3 issues within a week of use. And for 60 capsules to cost 4,000. When you compare it with Nova's 10, it's about, be it 5 milligram or 10 milligram, it's about 2,000 to 3,000 naira. And you only use it for 1 week or 5 days. And this one, you use it for a whole month. I think cost-wise, this is accessible. If you bear in mind, we have to import our capsules from India. We have to import our machines and all that. The cost from the beginning is a little bit high, but with time, we intend to come down when we must produce these items. On a final note, I want to remove issues of doubting Thomases with respect to herbal. We are in the era of herbal medicines, either we like it or not. It has come to stay. And that is why probably a whole WHO could form ANDI. That is a body that is researching into discovering new drugs and diagnostic products for registration. Who can discover my own anti-malaria and then sponsor me to a United Nations occasion in Ethiopia to present it. So let many people who have doubting minds about the use of herbal medicines, is not based on incantation. Mine has been proved clearly that those things, tomato, carrots, and what have you, they have a lot of vitamins. Vitamin A, which is it boosts immunity. It is a strong antioxidant. It is a strong anti-inflammatory. Vitamin E, glycosides, tannins, saponins, all these things that have been documented in various literatures about these various food items that are working, that we have been able to combine them in various forms to be able to get various products. They are all working, and as I speak with you, I'm in touch with where malaria parasite was first discovered in England. My products are there. They are online with me. They are trying to collaborate with me. And England, they have sent to us papers to register these products in England for the use of the European community. For people who that would like to reach out to me, I am on 080 37 899 735. I repeat, 080 37 899 735.